So now that we understand that the pelvic floor muscles are in charge of lifting up and lowering down, and that there's different parts of our pelvic floor muscles that we can recruit, we want to start practicing, and we want to practice in two different ways. One of the first things we want to do is practice isolating each muscle group. So you want to practice being able to do 5 urethral lifts, up and down, 5 vaginal lifts, 5 rectal lifts, and get so you're pretty good at finding them. Like you might be able to do urethral lift, vaginal lift, rectal lift. And these are great to try anywhere. Try them standing, try them sitting, try them lying down. And you want to get in the habit of trying to find these muscles often throughout the day. So if you're ever bored waiting in a lineup or just sitting down having your morning coffee, practice lifting up and lowering these muscles just organically throughout the day. Now, once you've got the hang of that, we want to start building up the endurance these muscles have. So one of the nicest ways to practice this is starting by laying down. So if you're laying down, remember that after about week 16 of pregnancy, you always want to make sure you're not laying flat on your back to exercise. You want to make sure that you have at least one pillow, if not two, just kind of propping you up so that way you're not flat on your back and you can still breathe. Now practice having your hands on your lower tummy. And again, you'll practice taking that deep breath in and fill your tummy with air, fill the baby with air. And then as you breathe that air out, think about engaging those muscles. And whether you think of it like an elevator coming up, floor 1, floor 2, floor 3, or whether you think about it's a zipper coming up your body. Always use that lifting imagery. And with your hands, you'll feel these muscles flatten and tighten. So as you take a deep breath in, you're relaxing. As you breathe your air out, you're recruiting, especially those vaginal and urethral muscles. Pay particular attention to lifting up the vagina, lifting up the urethra. And you can see how that flattens your tummy muscles, or you'll be able to feel it under your hands. And now you want to practice some endurance with that. So you want to be able to say, can I hold on to it? And at first, it's really tempting to kind of do your pelvic floor lift and hold really tight and hold your breath. But we don't want to do that. We want to keep breathing. So as you breathe in, and then as you breathe out, you're recruiting your pelvic floor, you're lifting through your pelvic floor, but you don't have to lift up a hippopotamus. You just want to lift up so you can feel your tummy muscles flatten and tighten. Now watch out that again, you're not holding your breath. Watch that you're not squeezing your glutes too much. Just a lot of vaginal, a lot of urethral. You'll feel this muscle flatten, and then see if you can hold it on. See if you can have a conversation with some of your other kids, or see if you can kind of keep breathing and being able to hold these muscles on in the background. What we're aiming for is that you can hold these muscles on for say 10 seconds and then take a break. When you're taking a break, you might want to take 2 or 3 nice deep breaths just to help flush it out. And then you'll try it again. And building up your endurance with these muscles is really important. So as these muscles get stronger and as you're able to hold them on for longer, say you get to the point where you could do 10-second holds, that means fantastic things for your body during the pregnancy. So women who have really good control of their pelvic floor muscles and they've been building up their endurance with these muscles, everything gets better. So second stage of labor, that pushing phase, can be more effective. There's way less risk of back pain or hip pain or pelvic pain, both during the pregnancy and even after your baby comes. Having these muscles be strong now also means there's going to be way less risk of things like incontinence or leakage, prolapse and things falling out of the vagina that maybe shouldn't be falling out, as well as just different pelvic pain, painful sex. So keeping these muscles strong, building up your endurance with these muscles is really important. And now we're going to be using all these pelvic floor muscles to help strengthen our core muscles. So what we're going to be discussing next is how these pelvic floor muscles lift, how they recruit our abdominal muscles, which is wonderful. But now let's take it for a ride and see how these muscles work during movement and during loading.